EP Waltham Forest. I'm also a clinical lead for CEG. So welcome to this webinar. As Faye has just mentioned, we will be recording so that we can put it onto the website and share with those who are unable to attend today. Main purpose of this meeting is just to give you an overview of what CEG is currently doing to help benefit practices in Waltham Forest. Got a few different people who work for CEG on the course, so I'm going to let them introduce themselves. There will be an opportunity to ask questions. Feel free to ask questions in the chat box. One of us will try and answer them as we go along, but there'll also be an opportunity to ask questions at the end, and also an opportunity to have your own say. Faye's kindly put the slides up, so this is the outline of what we're trying to cover today. Sorry, my computer's just frozen. There you go. So I'm going to try and update you on the local services and the new schemes that are currently out. Quick touch on what we can offer for PCNs, as well as a QOF update, and then also go through the APL tools that CEG offers all practices. And as I mentioned at the end, there'll be an opportunity for everyone to contribute. Until then, if I can ask everyone to make sure that they are muted if they're not talking. The CEG facilitators will introduce themselves as they present. I'm going to hand over to Faye now, who's going to go through a few slides for you.
Okay, hello everyone. So first off, who is CEG? CEG, we're made up of GPs, analysts, data scientists and facilitators, and we're based at Queen Mary University of London at Whitechapel. We have access to primary care data across NEL. We build dashboard searches and software tools for GP teams, NHS commissioners and public health. We have facilitators. We don't have any support officers anymore, but we have a facilitator assigned to every place within NEL. We publish research on national and international significance, and we are funded by NHS and local authorities in NEL, and we have research grants. So using the primary care data that we have, we do it to improve populations. We do this by, we support high entry, high quality.
Yeah, I think we're good, Faye.
Perfect. Right. Okay. So back where I was. So with the primary care data that we have, we support high quality data entry. We build dashboard search and software tools for GP teams, commissioners and public health. We support 272 practices across North East London. And like I said, each practice has got a facilitator. We publish research of national and international significance, and we lead on the Welcome PhD programme for health data in practice. Okay. So the aims and objectives for this workshop is to provide you with an understanding of what updates there are within the local SNS services and QOF, what support we can provide practices and PCNs, the CEG APL tools that we have and what is available for you, and then also, like as I said, a section at the end to hear from you and what you need from us. So to start, what local services are there for Waltham Forest? So we have got a fair few. We've got the LTC SNS, CKD KPI, the complex care palliative care SNS, and the palliative care and nursing home SNS. For the nursing home SNS, this is only for practices that have got a nursing home attached to their practice. So it's not all practices that are eligible for this one. We have the LTBI, the asthma and COPD KPI, the SMI physical health checks SNS, type 2 diabetes care plans, the NEL phlebotomy SNS, which is new, and we will be discussing this, the data accreditation and improvement scheme, which again is new, and we'll be discussing this one as well. And then you've got your public health ones, which is your NHS health checks and your sexual health. So the services with no change this year is your CKD, your asthma and COPD, your complex care, palliative care and nursing homes, your latent TB, SMI, type 2 diabetes and your public health schemes. So your LTC SNS has gone through a change this year, and to be eligible for a full asthma review, COPD review or diabetes review, there are certain elements you have to meet. So for asthma, you need to have your ACT and RCP questions, your inhaler technique check, your lifestyle and social issues, which includes your smoking status, your assessment of depression, physical activity, and your BMI. You have to have given or offered the pneumococcal vaccination, and you have to have given or the patient declined the influenza vaccination, and then the asthma action plan. Same as COPD. You have to have your CAT score and your MRC score, your inhaler techniques, your lifestyle and social issues, which again is the same as what it is for asthma. You're expected to have given or offered the pneumococcal vaccination, and given or patient declined the influenza vaccination, and then have a COPD action plan. And then for diabetes, you need to have done your 8 care processes, which is your BMI, blood pressure, cholesterol, foot exam, HbA1c, serum creatinine, smoking status, and urine albumin. And then on top of that, you need to have completed or advised the patient to have their retinal screening. These do not need to be done all on the same day. As long as they're there within the year, then they're counted as the full annual review. Okay. So then moving on to the data accreditation and improvement scheme. This one recently went out for sign up. Deadline was the end of last month, but we're hoping for just a slight increase on the sign up deadline. But initially, this is broken into 3 phases. Phase 1 is your setting up phase. So this is signing up to your spec and your staff training. And your staff training is signing up to Edenbridge Apex and signing up to your data sharing agreements for Edenbridge and having your data sharing enabled for the practice on Apex. And then you have to have done your evidence of adoption for this, so your preferred consultation types and your preferred practice job roles. And for this, we will be sending out a practice guide fairly soon on what are these preferred consultation types and job roles. And then for phase 2 is your wider determinants of health. Again, this is split into 2 parts. So for part 1, you need to have coded ethnicity, carer status, language, communication, and contact preference. And this is for all new registrants from the 1st of September 23, and all patients classes at risk from the 1st of April 23. And then for part 2, it's your same cohorts again, but you need to have your isolation, literacy vulnerability, housing vulnerability, and employment and income vulnerability coded. And then from that, if someone does come with a vulnerability, is signposting them to who can help, whether it's your social prescriber, your local council for housing, etc. Yep, so that's phase 2. And then for phase 3, go back. Phase 3 is your accreditation visit at the end of year 2. So this is where we'd go through and make sure all the system requirements are in place and that all your required training has been done and that you've achieved a minimum of 25% of the threshold on phase 2. So with this scheme, it's not like all of them. It's quite different in terms of you can sign up and do absolutely none of the work. That you literally get paid for what you do. So there is no penalty for signing up and not delivering. So if you sign up and don't do phase 1, you just do phase 2 and you meet the thresholds for that, you'd get paid for that, and vice versa. And from this one, again, there will be a webinar which we are holding, I think it's mid-July that we'll be holding that one. Invites will be going out fairly soon in the bulletin. Also, we have the wider determinants of health page within all of our templates across Waltham Forest. And we will be providing some support searches for the wider determinants. You know exactly who your cohort are to target. And there will be an AccuRx flurry as well, which you can send out and get a bulk of this information back, hopefully. And then we have, again, another new service, which is nail-wide. It's a phlebotomy service. So for this one, there are 2 separate payments, whether you're practice doing the activity or a PCN doing the activity. If a practice wishes not to deliver this service within the local commissioning arrangements, you can contract another practice or suitable provider, i.e. your PCN, to provide this for you. If a PCN provides this service, they get an additional £1 per bleed for delivery. to reflect on the need to provide the cross-practice and appointment systems. So practice payments for the practice-based bloods, you'd get £4. For your GTTs, you get £8, and for your domiciliary, you get 16. And then your PCNs get £5 for the clinic-based bloods, £10 for your GTT, and £20 for your domiciliary. And again, there is a CEG template, which I strongly recommend using because the code is different to what automatically gets put in for bloods. So we're not necessarily picking up all of your activity. And also, if you're doing it on behalf of another practice or the PCN's doing it on behalf of a practice, there's also the blood taken by other GP practice that needs to be coded. And there will also be, which I'm working on this week, a quality search to help you identify patients that's had bloods that might not have the correct coding on their records. Okay, so now I'm going to hand it over to Assad to do just a live demo of the resources within EMIS.
Thanks, Faye. So most practices will know what I'm going to show them, but what I want to do is show you EMIS and a few other resources that we have at CEG. So one of the common questions I get asked by practices is they don't know where the searches are, or their searches are coming up with the correct information. So this is my practice's EMIS here. All of what I'm going to show you is actually available on the website, which I'll show you as well. Essentially, it shows you when and how to copy your folders over. So on EMIS, and Sister One, I understand is slightly different, but this is very much focused on EMIS because majority of practices are EMIS based. Any of the Sister One practices can reach out to us directly and we can help them if they have any issues. So on EMIS, on the template function here, on the left-hand side, you've got the CEG folder. That's where everything is housed, and if anything's updated from CEG as it is, as it was last week, Faye in her weekly bulletin will notify you. So if anyone saw the bulletin last week, you would have noticed that there's quite a few updates that Faye has put through, so they need to be updated. If you don't get the bulletin, it'll be a good idea to email Faye to make sure that you are on the email list. That bulletin comes out once a week and has some really important information. The top folder is the folder that you really want to be dealing with. So this is basically the practice support folder, and within this, there's 7 subfolders that covers a number of different things. What I recommend practices do, if they haven't copied things over, is to create a CEG folder. So I've called ours CEG 2324 in our EMIS, and copy over each folder individually, one by one. You can try and copy it all over as one folder. It will probably crash your EMIS. So do each folder one by one is what you want to do. What you can do is time the searches. So I normally put a time search on for our searches to run on Friday or Saturday, so that when I come in on a Monday, all the searches are up to date. I haven't set that fully for this financial year. I'm going to go through a few of these searches just to show you what we do offer. So folder 1 is the ICS contract. So within that, you've got things like the CKD KPI, palliative care, the SMI health checks, and the LTC SNS. If we look at the CKD KPI, I ran this, so you can see this ran this morning. It gives you all the different KPIs and what you need to do. So another question I tend to get is the dashboard, the CEG dashboard isn't up to date. Well, it's only updated normally once a month, if not once a quarter, depending on the indicator. What you really want to be using is your search at practice level. So this search here tells me how many patients I've got on my current CKD register, how many of those patients have got blood pressure controlled or not, who needs a statin review, and who needs an ACR. So all 4 indicators for that CKD payment are all there. The other domains also have everything that you need there. Folder 2 is your public health contract, so the invoicing tool, predominantly for NHS health checks and any practices that sign up to the sexual health enhanced service as well. Everything is in the invoicing tool. The NHS health checks is a really good search. It's probably one of the most used ones. So within this health checks search list, you've got the eligible patients. So in my practice, because we've been doing health checks every year quite a lot since COVID, we've only got 738 eligible patients this year. Tells you who's been invited and how many you've done. So thus far since April, my practice has done 118. What it also tells you is how many incomplete you've got, and it breaks it down per quarter because that's the payment structure. So in my practice, I've got 2 health checks that I need to look at that haven't been completed. And what that means is you haven't hit the 6 main domains, so something's missing. So you can show the search to your HCAs and say, look, can you just go through the list and see? In this case, it'll be 2. So if I was to click on one of these domains here, it'll show up, and you can identify the right patients. So it's really, really important that you do that once a quarter, just to make sure that you're actually getting paid for the work that you've done. The PCN contract subfolder is a work in progress, but we've got the SMI Health Check folder here again. There is, with most KPIs in Waltham Forest, there's a bit of crossover. So some things are both QOF and KPI, some things are QOF, KPI and IAF. With the SMI Health Check, the local enhanced service incorporates everything that's nationally needed plus more. So do use the KEG search. Do not rely on just an IAF search, because you'll miss domains. The NEL requirement requires you to do more to get paid the uplift. So you do use that. We are working on a PCN dashboard, so hopefully we'll have that ready in the next month or two to show you the new indicators, including access. So we're working on that, but right now we've got the searches here. QOF, I'm not going to go into too much because Tracy's going to cover QOF and all the changes. But I will highlight we've got the prevalent searches, which is really important. And again, Tracy's going to mention that, as well as the expiring exceptions as well. So the QOF searches are really, really important. We've also got immunizations, which most of your nurses will know. And there's a separate webinar, I think 2 weeks time. Was it next week? I can't remember quite. I think 21st. I want to say. But we'll confirm the date for a nursing webinar to go through the KEG tools that specifically will help nurses. One of the main things right now that practice in Waltham Forest need to be focused on is the polio. So with polio boosters, a lot of children are now eligible for another jab or are out of sync. So how can the KEG searches and the APL tool help with that? So for those who have nurses in their practice, please do make sure they sign up to that webinar and join that. Risk stratification hasn't got anything updated yet, and then there's miscellaneous as well. So these will keep getting updated. Please do look at the bulletin. Please make sure that you are updating the folders before you reach out to KEG to say, look, things aren't quite looking right. It normally is because it needs an update, and the bulletin will highlight that. The other resources we've got on KEG is the website. So the website's going to be updated soon. That's a work in progress. But just to highlight, again, there are clinical guidance. So all the URLs, if you haven't got it, are at the end of the slide deck, which will be shared out. There's a lot of clinical guidelines here. So things like abnormal LFTs and things like that. This is really good for induction packs. I've got these in my induction packs for my new starters. It's really useful. You've also got local resources. So where the bulletins are kept as well are all here. So if you've missed it, you can find the new ones. The new ones will be on a new website, hence why the last one here is only in February. We've also got the dashboard website. Again, the URL will be at the end of the slide, including the username and password, which is generic. And this is where all the dashboards are kept. So all the enhanced services, as well as searches, there are dashboards. Some are Power BI, some are still in Excel. I'll give you an overview of those that haven't seen it. So this is the health check dashboard. I prefer this view. The main view is this. So this is my practice. I actually prefer the view here. It depends on what your preference is. But you can have a look through exactly your list size, your eligible population, and all the indicators are there as well later on down here to say what needs to be done, what hasn't been done, what your numbers are, making sure you're invoicing appropriately. We also have the CKD one, and I'm not going to go for everyone. I'll just show you the CKD one as well. So this is, again, my practice. This was updated last quarter, and it will be updated, I think we're saying Wednesday, Faye. A lot of the dashboards we updated, so that we have to run the searches manually and then upload. So some things, like I said, are monthly, some things are quarterly. This dashboard here essentially shows what my practice done. So ACRs in CKD patients, the aim is 50%. We managed to hit that target. And Waltham's average isn't too bad. We're just off the actual target there. The other indicators, so patients with who are blood pressure controlled, again, it tells you that you've hit the target. And then those on a statin, again, we've hit the target. So we're quite good from that point of view. If you need a PCN summary, you can by clicking on the next screen. It tells you what your PCN's doing. And then again, with the dashboards, I recommend System 1 practices run the searches on System 1 to get more accurate data at the right time. And I think that was all the support I was going to show. Feel free to ask questions in the chat box, or we can come to it at the end. Thanks, Faye. I'll stop sharing that slide.
Just say for System 1, you'll find all your searches within the CEG Waltham Forest folder. Unlike EMIS, System 1 searches don't have to be copied over to anything. You can just go in and access them straight away. And then there is a list of all the templates that we provide across EMIS and System 1. Okay, so just as Asad mentioned, with the PCN network DES, we are looking at updating the IIF dashboard and reviewing what other areas we can support within the PCN DES. So this is just a screenshot of the social prescribing dashboard, which is done nationally, it's not done by us. And then I'm going to hand over to Tracy to do QOF.
Hello everyone, my name's Tracy Gibbons and I'm the primary care facilitator for the BHR area. So what are we going to cover today? So first of all, I'm just going to briefly go over the QOF points overview. Then we'll move on to the new QOF indicators, then to the changes, and then what can CEG offer you? So with the clinical indicators, the points haven't changed. They've remained exactly the same. The only benefit from this is you are now getting £213.43p, whereas last year it was lower. So you're still 401. Sorry, Faye, can you go back? 401 on your clinical indicators, 74 points for your quality improvement, and then 160 on your public health. Okay, so moving on to the new QOF indicators. What the first one we've got is the atrial fibrillation. It may seem slightly familiar, and that's because the new AF08, which has replaced the AF07, is the IIF indicator from last year for CVD05. And it's looking at your patients on the AF register who've had a CHA2DS2-VASc score of 2 or more and were prescribed a DOAC, or if the DOAC was declined or clinically unsuitable, a vitamin K was issued. So that's the new AF indicator. Then we've got your mental health. That is the same apart from one change. So that's your patients on the mental health register have to have all 6 elements of the physical health check recorded within the year. And the main change to this is that it's now including smoking status. And what we advise is if there's anyone over 25, they normally say if they haven't smoked at that point, the likelihood of them to start smoking would be very slim. So once you've coded them after that age as never smoked, then you wouldn't need to do it every year, just the once you've done it. And then we move on to the completely new section, which is the cholesterol control and lipid management. So the funding from this has come from the retired rheumatoid arthritis indicator that was available up until last year. And what they've replaced it with, so you've got CHOL001 and CHOL002. And your first one is patients on the CHD, PAD, stroke or CK register they've currently been prescribed a statin, and when the statin is declined or is clinically unsuitable, then another lipid lowering therapy has been issued. And then your second one is the patients on the same register, but who have a recording of non-HDL cholesterol that is lower than 2.5, or where the non-HDL cholesterol is not recorded and a recording of the LDL cholesterol is lower than 1.8, and that's within the preceding 12 months. So they're the 2 main changes within the QOF. We've also got home blood pressures. I've grouped these into different groups because there's quite a few different QOF areas. So your first one, so this is in addition to their having a normal blood pressure recorded, they now need to have a home blood pressure recording. So you can see your CHD 15, hypertension 8 and stroke 14. So the latest BP is 140/90 or less, but the home blood pressure would need to be 130/85 or less. Then the CHD 16, hypertension 9 and stroke is latest BP 140/90 or less. And then the home blood pressure would need to be 140/85 or less. And then the last one, you've got the DM33. So the latest blood pressure would be 140/90, or for the home blood pressure, they're looking for 135/85. Now, with this, we know last year that there was an issue with if you used Accurex to send out the messages for them to do their blood pressure, and it was coming back and not recording them correctly, but we've been advised that this has now been rectified, so that should not be an issue this year. And some more changes we've got is your heart failure register. It's now from the 1st of April, and they're required to have an ECG or a special assessment in the 6 months before they've been entered onto the register. So just make sure that whenever they're being referred or having the assessment done, that it is within the 6 months before the register. Then you've got the date change for the asthma, COPD and heart failure diagnosis. Again, that was previously from the 1st of January 23, but that's now changed and it's now from the 1st of April 23. And then you've got your COPD 14. The changes to that are now that it's to record a referral to pulmonary rehab, whereas previously it was to record the offer of them going to pulmonary rehab. So just make sure that it's to record the referral and not the offer of the referral. Okay, so I'm going to move on to childhood immunisations. And firstly, we can see, unfortunately, they have decided to take back where you used to be able to claim back if it was 80% less. They have taken that away, so that is no longer available when it comes to childhood immunisations. They've also, which is very good, lowered the lower thresholds. So for your VIO1, it's 89%. For your VIO2, it's 86%. And then for your VIO3, it's 81%, although they have upped the upper threshold. So now for all three of those, the higher threshold is 96% on those ones. They have now included a PCA. So what they've done is for patients who have registered at a practice too late in the year, or too late due to their age, if they haven't had their immunisations through no fault of your own, you can now apply the PCA, but that's only within the financial year. And then, unfortunately, when it comes to patients the parents that have declined the vaccinations or they've not attended their appointments, unfortunately, you can't use that PCA, but we would just recommend that you carry on with your protocol that you have in place for the immunisations. And with the polio, as we had the extra polio vaccination that was meant to be given last year, what we would advise is, I'm sure everyone's aware that we've got the APL immunisation tool, which my colleague Krishma will go into a little bit more detail. But if you use that tool will pick up those additional vaccinations that the children's had, whereas unfortunately QOF isn't picking those up. But if you use the tool, it will pick up the additional, and then it will now also bring back in line if they are due their next polio vaccination as well. So what can we at CEG offer you? We've got the available searches for you in both System 1 and EMIS. In EMIS, they're in folders number 4, QOF, DES, CQRS, and then the same for System 1. And these are the prevalence improvement searches. So these are very good. We advise you to run them around about January, and these just help you with your registers. You may have a patient that comes up on there. We're not saying that they have to go on the register, but it's just telling you to have a look within the patient record. They may have been, say for instance, on the asthma register, they may have been given an inhaler, but it may not have been due to asthmatic reasons. So just go through each indicator and have a look, and put them on the register if appropriate for each individual patient. We've also got templates that are available for you. And what we advise is if you use the CEG templates, you can guarantee that they will cover the QOF elements that are needed. Plus, they will also cover all of your SNSs. So all the information that you need to record to be paid for both QOF and for your local enhanced services, that will happen if you use the CEG templates. So I've got a screenshot here. We are currently updating our LTC template, and we are hoping that this will be available from the 1st of July. This is just a screenshot of the AF page, but you can see it's got all the information that you need. So it lists exactly what needs to be done for QOF, and then it will also have your LIS information. And we always put the stars in there. So I always say stars means prizes. So just make sure anything that's got 1 star or 2 stars, that you make sure that that's being filled in on the template and that it's within the year as well. And that's it from me. So I'm going to pass you over to my colleague, Karishma.
Hi everyone, my name is Karishma and I'm a clinical facilitator with CEG. Some of you may have seen me during your practice visits. In this section of the webinar, I'm going to brief you around all the APL tools that we have available for you or that are imminent. Please note that because we've got webinars already for all these tools, I am just going to brief you over what they do in case you haven't come across. At the end of the webinar, we've put links for you to refer to the recordings of the full detailed webinars that we have upon release of each of the tools. So on your screen here, you can see the 4 different tools that we have active or near ready to be launched in the next couple of months at the most. First one is the cancer diagnosis audit tool. If you attended the previous webinar by myself, you would remember that the purpose of this tool was to review your practice's processes around suspected cancer referrals leading to confirmed diagnosis. So this is a tool that you use to look back at your newly diagnosed cancer patients and look for areas when you can improve. The National Diabetes Prevention Program tool is a tool that allows you to easily view a list of patients who are eligible for referral onto the program and for you to be able to see who hasn't been referred yet. The renal tool, also previously known as the falling EGFR tool, is one that will assist you in the management of patients with CKD. With the children's immunization call-in recall tool, this one will allow your practices to view children with incomplete or overdue sets of immunization and help practices have better call and recall processes in place. Next slide, please. So the CEG cancer diagnosis audit tool that helps with the service requirement under early cancer diagnosis PCNDES, which requires practices to look at how they are going about referring their patients and so on, and then look for areas where they can improve. It's a reflective tool. It's not to manage your cancer patients. How it works in brief: you audit your newly diagnosed cancer patients. Generally, you can audit at the 3 months for each quarter, so 3 months retrospectively. You review your referral practice that you currently have in place. You identify areas for improving, so maybe in terms of presentation, in terms of investigations that you're sending patients for, and you implement that change. You repeat that for the following quarters, and then you repeat the whole process again. So I know this slide might not be clear, but as I said, it's just to kind of give you a little overview of how it looks. So on the cancer diagnosis audit tool, it's quite extensive, but please note that it's been reviewed by your locality cancer clinical leads, and we've brought it down to what the PCN DES requirements are and helps you tick each of the requirements. So it automatically brings patients list from your searches, and also auto-populate certain fields such as ethnicity, housebound, dementia, NSMI codes. So if your patient's on any of these comorbidities registers, it will pull those data as well. Any field in blue is auto-populated, and anything in white will be the bits and bobs that, as a reviewing clinician, you will fill in. So things like, at what stage was that patient diagnosed, what tumor group the patient falls under, whether that patient had any communication difficulties, when did they first present, and with what symptoms, and where did they present? Was it in your practice or was it outside? And how many times did they have to attend your GP practice before they were, they were then referred, and what investigations were requested. So that's the CEDAT in brief. Next one, please. Next, we've got the National Diabetes Prevention Program tool. That helps with the Healthier You NHS Diabetes Prevention Program scheme. It helps with patient referral management. So looking at, as I said, who are eligible and then whether they've been referred or not. So it's for your patients above the age of 18 with pre-diabetic sets of results. So a HbA1c or blood glucose between above the normal range, but not in the diabetic range. So you again run the search for the eligible patient cohort. You should be able to note their latest HbA1c or fasting blood glucose to be in the pre-diabetic range. And then you've got columns that tells you whether they've been referred or not. The advantage of using the tool is that you can easily export it to AccuRx to action. So if you want to sell bulk text messages to these patients who've not been referred, offering them, you can do that. And that allows you for effective time management. And then you can choose to then repeat the same at regular intervals. And if you've already used the tool, it should look like something like this, where again, you've got different filters. You can choose whether they've been referred or not, or whether they've declined, what are their different age cohorts, or whether they are above the age of 65 or less, what different ethnicity groups they belong to. So you can choose to filter by South Asian, Black, White, or others. You can choose to look at different BMI ranges, and then you can also choose to look at you can also choose to filter by different comorbidities. So whether those patients have got existing CVD conditions, hypertensions, and stuff like that. The second image on the right is basically a patient information page that you can also view in the tool. So you can click on a specific patient and see detailed information about that particular patient in this format. The next tool is the renal tool. It helps with management of CKD patients on your QOF register and helps you comply with the NICE guidelines around CKD patient management. And again, this tool is at the moment under review and should be released in the next couple of months. The way it will work is you import your eligible patient list, so it should pull your CKD patients. It will allow you to again see patients with comorbidities, and you can then identify what actions are needed. So whether they need to be referred or they need to have a medication review, and then you can action appropriately. Again, you can action patient by patient, or you can choose to export the list in bulk and then action as appropriate. So whether you need to send them bulk text messages or contact them in bulk, you can do that. And the purpose of this exercise is to improve your CKD coding. Similarly, as the diabetes tool, you will have filters that you can filter your patient list by. So again, fall in EGFR, what their blood pressure reading was at the latest consultation, whether they've got AF or other comorbidities such as diabetes, AF, hypertension, heart failure, whether they're on a statin or not. You can again choose to filter by different indicators. And again, you can also see individual patient information by clicking on the patient data page, and again, looking at specific patients. Last but hopefully not the least of our tools that we will have available for you is the CEG Children Immunization Call and Recall tool. This will help with your vaccination and immunization course, as Tracy highlighted, and it will help you comply with the UK childhood immunization schedule. It's a childhood vaccination recall management tool. So again, the way it works is it allows the search we've got for you allows you to pull patient lists between the ages of 0 to 5 years, and then you can identify which patients have got incomplete sets by looking at the different columns that are checked and not. You can filter by those who are due for a set of a particular immunization or overdue, so you can choose when to recall this patient. Some of them might need an appointment sooner than the others, and then you can also have individual patient information page that will allow you to look at their contraindications or declines. And again, you can choose to bulk action by exporting your patient list onto either OneContact or AccuRx. How to access these tools. So what I've put here for you is the link for accessing so these are the request forms for each of the tool. After the webinar, as you know, you will be the slides will be shared with you, and you can click on each hyperlink to request for each of the tools if you haven't used them yet. As I mentioned, the renal tool is currently under review and it will be released in June or July.
Thank you, Karishma. Okay, so then it's just CEG resources. As mentioned before, the link to the website and the link to the tools and the dashboard are all in this slide. And again, you can click on each of them and it will take you to the correct page. With the dashboard link, the login details are there. Please do not share them. If anyone wants access to the dashboard, they would need to come to us and request the access. Also, the CEG bulletin, as I said mentioned, this is sent out on a weekly basis, generally on a Thursday lunchtime, and it has all the latest information at nail-wide and Waltham Forest. So as you would have seen, last week's bulletin mentioned around the nail nurses webinar, which is happening on the 21st of June. And then as always, you've got your local CEG support. You've all got my email address, so you can contact me at any time if you need any help or support with any of the local services or national services, or any of our resources that we provide. I'm now going to open it up for any questions.
I don't think we've got any hands up, Faye. If anyone does have any questions, please feel free to raise your hand or put it in the chat. We'd also like to hear from you as to what else you would like to see from CEG. If it's within our contract and we feel that we can help support practices, we're always willing to engage. I think we've got a very satisfied group, but as it looks of it, Faye, no questions from anyone.
I like it.
Non-diabetic hyperglycemic template. I think that's a good suggestion. So as Tracy mentioned, we're going through the templates. What I would really like as a clinician is one template to do everything to all the KPIs, and that's what we're working towards. So we can look at a pre-diabetic one as well. There are no questions and no suggestions, and we can end the the meeting a bit sooner. But please do feel free to contact either myself or Faye if there's anything Waltham Forest centric that you need. Keep an eye out on the bulletins as well, as both Faye and I have mentioned. The only thing I would say that Tracy mentioned with regards to prevalence in January, just to reiterate, the reason why we did the prevalence in January is so that practices have a little bit of leeway before getting to ensure they get the prevalence up in time for the QOF year. But it also means that you do not need to do the LTC review. So let's say you code a new asthmatic in January, you don't need to necessarily do the asthma review until the following year. It just gives you a little bit of leeway. If you do it pre-January, you need to make sure the asthma review is done before the end of that March, to ensure you hit your QOF points. This webinar is recorded. It will be shared, so please do share it with everyone. Faye, was there anything else you wanted to add?
No, just if there is anything else that comes to mind after we close the webinar, just drop me an email and I'll be happy to help. And yes, the webinar is being recorded, so it will be added to probably next week's bulletin now, once we've done the editing and everything and put it on the website.
Brilliant. Are we happy to end the call, Faye?
Yeah. So thank you all for attending.
Thank you, everyone.
Thanks.
Thank you.
Bye.
Bye. Thank you. Bye.
Bye.
Thank you.
Thank you. Bye.